Hi there, I'm Dr. Dana O'Neill, your family chiropractor. Today's segment, we're going to talk about the neck problems, neck pain. About a third of the patients that we see have come into us as a result of neck problems, headaches, neck pain. And I want to talk about the degeneration of the process and this video illustrated from what we see on this chart where a lot of our problems started. And in actuality, a lot of them started years and years ago, even as children. Falls, accidents, injuries, trauma. You're talking on the phone for hours and days and months on end, and the joints can get subluxated, we call that, when they're not moving properly. They lose their normal motion. And when that happens, the disc starts sitting in its own sewage, because that is, motion is what keeps the joints lubricated and healthy. And we always have to remember in the middle of that is your spinal cord. The spinal cord and these nerve roots which innervate all the organs of your body, all your joints, every twitch of a muscle is controlled through the central nervous system. So it's always serious when we have subluxations of the spine. And again, that's why we encourage parents, get the kids in early. Bring them in for regular chiropractic care like you bring them in for regular dental care. If you keep the spine mobile and flexible, they're going to have less problems down the road. Because people often come in, we look at their x-rays, and we say, oh my gosh, there's a lot of disc degeneration, arthritis, And they'll say, yeah, I just got an old spine. So, well, look at the disc above it. That one's perfectly normal. Looks like a 20-year-old disc. The one below it here looks like it's about 50 or 60 or 70 years old. It's the same disc. They're the same age. What happened? That's because years ago, whether it's from a car wreck, whether it's from childhood injuries and falls, those joints got locked up, the disc started sitting in its own sewage, started drying out, started the degenerative process, and we take painkillers, we take aspirin, we ignore it, we've got a stiff neck. Those are all warning signs that should be treated early on with chiropractic care. The sooner the better. That's why we treat babies. The birth process is rough on them and rough on their neck. So some other adult problems came from the trauma we had in the birth process, and then falls and injuries. So when patients come to us with neck pain or arm pain or shoulder pain or carpal tunnel pain, this is the place we start, because most of our problems start back here in the core, in the center of the spine. And most of them we can trace it back to old injuries we had as children or young adults. Trauma, just things that happen to all of us. So it's very important that everybody be under regular chiropractic care for a lifetime. Get the kids started twice a year. Get that spine adjusted at least twice a year. Find and fix any misalignments, fixations before it becomes a problem. Just like you take them to the dentist, get them in the habit of checking their teeth, brushing their teeth, flossing their teeth early on. You don't want to wait till they start having dental problems. Get the kids in to get their teeth checked, get them in to get their spine checked. The difference is you can replace your teeth. We cannot replace the spine. And most of these problems we see in the later life started when we were children with normal, typical falls. So please take the kids in for a regular chiropractic adjustment starting from birth on, at least twice a year. As we like to say in the chiropractic world, when your spine's in a line, you'll feel fine. I'm Dr. Dana O'Neill. I'm your family chiropractor.